COVID-19 has put research at the center of the global conversation. A recent survey shows that up to 89% of people in the United States have reported to be following COVID-19 news. 48% of the surveyed reported seeing some made-up news. With the increase in publications, academic journal submissions are up by 25%. However, most of the articles continue to show a gender imbalance for authorship. Government and organizations around the globe have encouraged that all relevant information about the COVID-19 outbreak and resulting research is shared openly and rapidly. However, a crisis such as this pandemic is not an excuse for lowering scientific standards. A proper balance between scientific rigor and the race to find a treatment for COVID-19 should be always prioritized and maintained. For optimal scientific rigor, 5 conditions of informative and social values should always be embodied by research, including its importance, the precision of the design, its analytical integrity, its feasibility, and its accuracy, reported completely, promptly, and consistently. We cannot ignore the fact that COVID-19 is reshaping how research is conducted. Open science is opening the door for excellence and interdisciplinarity among researchers, encouraging, therefore, equity, diversity, and inclusiveness, and delivering rigorous and trustworthy data.
Good afternoon, everyone. I'm Dr. Blaine, a postdoctoral research fellow at the University of Ottawa Heart Institute. I hope everyone is healthy and safe at this time, wherever you are. Thank you for joining us in our COVID Spectrum Panel Discussion Forum, a communication initiative in partnership with the Natural Science and Engineering Council of Canada, with the goal of navigating the waves of the COVID-19 pandemic. Some housekeeping notes to help navigate the webinar today. The panel discussion is set up in 2 sections. First, each panelist will introduce their expertise with regards to our topic. The second section will open the floor for a Q&A discussion where the panelists are invited to answer your questions. Please keep your microphones and camera off during the presentation. If you have issues to connecting to the audio, you can call in by phone. Please refer to the email sent after your registration for phone numbers and meeting ID and password. For all your questions, please use the Q&A function button on the platform, and we will direct all the questions to our panelists during the open discussion of the webinar. This webinar will be made available on the COVID Spectrum YouTube channel soon after recording. Check our website, Twitter account for the video release. Today, we have the pleasure of presenting our discussion topic webinar tackling the effect of COVID-19 on research. And to help us navigate this topic, we have a panel of experts here. Let's introduce them briefly. And for this, I'll give the virtual podium to my partner and co-founder of COVID Spectrum, Dr. Gary Bay.
Thanks, Alice, and thank you all for joining us today. It is my pleasure to introduce to you the panelists for our research webinar. To give a brief introduction about our panelists, we will start with our first guest for today, Dr. Alejandro Adem. Dr. Adem is the president of the Natural Sciences and Engineering Research Council of Canada, ANSERC, since October 2019. Before joining ANSERC, he was the chief executive officer and scientific director of MITAX. Dr. Adem is an accomplished researcher in the field of mathematics and has significant leadership experience in the research and innovation ecosystem. And to start you off, how do you think COVID-19 pandemic has affected research, specifically looking at it through your scope of expertise? Dr. Adem, please take the virtual podium.
Thank you. Thank you very much. And thanks to the organizers and fellow panelists for being here. Well, I started my position as president of ANSERC on October 1, and I was just learning the acronyms and how everything works when the pandemic struck. It was quite an experience. And the first thing I want to say is that I was very impressed at how quickly the funding agencies, the 3 councils, mobilized to address scientific challenges. And here, of course, the leadership of our colleagues at CIHR was extremely important. So the first thing that was done was make a call for proposals, rapid response proposals on COVID-19 research, supported by all three councils as well as IDRC. And the topics were truly multidisciplinary and really dealing with the science behind the pandemic. And there have been subsequent calls for funding. And I think we can feel that the top researchers in Canada who have the expertise are now engaged in multidisciplinary ways in finding solutions to the scientific issues that are there. In particular, I know groups of mathematicians, my expertise is in mathematics, working on the modeling aspects, both through the committee appointed by the chief science advisor and in different provinces, in particular as a faculty member at UBC. Now on leave, I am familiar with what's going on here in BC, which very, very close interaction between the scientists, the modelers, and the BC government. Now for us at NSERC, well, we're not directly working on many of the medical countermeasures, of course. We are supporting research into the technology, the applied technology that is very important for addressing the challenges. And we set up a rapid response call for proposals through our Alliance program. These are applied research proposals. And those, I'm happy to say that we received hundreds of proposals and $15 million were allocated to that. And we had industry, they sent us our problems. We constructed a bulletin board, and then researchers provided solutions, multiple solutions to them. So I think it's really an example of how government can respond quickly to precise challenges needed to address a situation like the pandemic. And I do want to stress that this goes beyond just things like vaccines and things. There's a lot of technology and things which will be needed to support any sort of recovery. Now, more generally, I also want to say that the pandemic has had an effect on our researchers, on our students, a very hard impact, especially those that need to gather data. Folks, for example, working in the Arctic area, the north, their whole field season is basically lost. And of course, a huge impact on caregivers, in particular, many women are affected, and just being at home, not being able to have the time and the space to do research. So these are things which have impacted our research community. And we have worked very hard together with our partners and the government of Canada to provide support for the personnel, for the HQP, for the labs. And there have been a number of measures that have been rolling out. And not enough. I think we need to do more to keep the new generations engaged, because there will be a way out of this pandemic through science. And I also want to emphasize our support for folks not working on COVID-19, because climate change is still happening. All sorts of challenges remain there in science. So we have to give support to young people working on these issues, whether or not they're directly relevant to COVID-19.
Thank you, Dr. Adam. Our next panelist is Dr. Shiro Koscheck. Dr. Koscheck is a scientist at the McMaster Immunology Research Center and the Michael G. DeGroote Institute of Infectious Disease Research. She is currently the scientific director of CIHR's Institute of Infection and Immunity. Dr. Koscheck's research interest is women's reproductive health, specifically basic research examining susceptibility and immune responses to sexually transmitted pathogens, particularly HIV-1 and HSV-2. Dr. Koscheck, how do you think COVID-19 pandemic has affected research, specifically looking at it through your scope of expertise? Please, the virtual podium is yours.
Thank you, Lara, and thank you to the organizers for inviting me to participate in this panel, and to my fellow panelists for being here in this busy time to take part in this. So I guess I'll talk about the effect on research from the two different hats I wear. So as you said, I'm the scientific director for the Institute of Infection and Immunity. So the pandemic, the COVID pandemic, falls very much within the mandate of the Infection and Immunity Institute. As many of you would know, CIHR has 13 institutes. The Institute of Infection and Immunity basically coordinates research and many other initiatives across Canada in the area of infection and immunity. So, so that's the first perspective of how I've seen this over the last 6 months. And of course, as part of my mandate, we were tracking this even before we went on Christmas break, because we knew that something was happening in China. So over the last 6 months, as things have unfolded, the Institute and CIHR in general, as Alejandro alluded to, has been sort of in the very much the thick of managing the Canadian response. In the last 6 months, I'm starting to lose count, but I think we've launched about 9 different funding initiatives in the area of COVID-19 research. The phase 1 was launched right after the WHO meeting that took place on the 14th or 15th of February. I remember on my flight back from Geneva, I was modifying the funding opportunity to align it with the newly articulated priorities from the WHO R&D blueprint. And then the second, so that was about $100 million for over 100 grants that was launched in the first phase. And as many of you would know, that the second phase, large phase of the phase 2 COVID funding just came out a week ago. And that was $107 million for about 139 grants that were funded. How do I see research change from a funder perspective? From a funder's perspective, we've had to respond with the speed and agility that typically national funders don't usually like to work with. Normally our time to think through, put together, and launch fundings in strategic initiatives. So that's not the open project grants that everybody applies to, because that just is initiated by investigators. But from a strategic point of view, where we want to invest money, it takes anywhere from about six to 18 months for us to put together those initiatives, because we consult the community, we put together what are the right areas, what kind of grant. The first phase, the phase 1 was launched in 3 weeks, and it was funded in 6 weeks. So that was an unprecedented event. And as Alejandro alluded to it, the tri-council agencies, IDRC, all came together. So the federal agencies coordinated with amazing agility that I would dare to say has never been done before. How many of us came together, and the speed at which the funding was delivered. So, so that kind of collaboration, agility, speed of funding, which was required, we knew back in February that this was going to be a pretty serious event. At that time, it hadn't been declared as a pandemic. And that's been sort of how the last 6 months have been, where every time you think that, this is going this way, there's an additional twist. So we've, right after we launched phase 1 funding, we were already working on phase 2, not realizing, what shape it would take place, what the pandemic would look like in Canada. Fortunately, we've not fared as badly as some of the other places are. Luckily, we've managed to keep it under control. Nevertheless, 8,000 Canadians dead is nothing that any of us would have liked to see. So from a funder's perspective, you can see that on the parts of the researchers, we've seen, again, amazing responses in terms of the resilience, the agility. Everybody's labs were shut down. They were at home providing care to children as schools were shut down. Yet every time CIHR has launched an initiative, we've been overwhelmed by the degree of response that we received from the community. Even in the last phase 2 application, I think the first time we got 215 phase 1, 250 application, and we said, wow, that's a lot. And then in phase 2, we got 1,500 applications. So, the agility, not only of people who applied, but the flexibility, generosity, and willingness to give time and be able to participate in this pandemic from the reviewers, because we've had hundreds of reviewers who volunteered their time, even as they're dealing with things at home and in their personal research space. So that kind of resilience has really shone through. Overall, I would say that perhaps the only silver lining to this pandemic is that science and research has taken the taken the spotlight, where everybody is now talking about research and what does research show. And I'm an immunologist by training, so I've never heard as many media people and as much public talk about IgG antibodies. That was a very much a immunologist jargon before this, I think. So in that sense, it's been amazing to see the public awareness of this. And then, perhaps I can talk a little bit about some of the not so great sides. And then, of course, the other hat that I wear as a researcher, as an HIV researcher, even as I'm dealing with all of this in the last 6 months, my personal lab and my actual research has been shut down just like everybody else. So that's something that all of us who are researchers are dealing with, and my lab is just starting to get back, into it. And it's been very stressful because students, staff, etc., how to deal with projects that need funding and need to move on. And I'm sure a lot of people identify with those feelings, of people who are non-COVID related researchers. So I'll stop there.
Thank you, Dr. Koscheck. And now we move on to our third panelist for today, Dr. Alexandre Mebaza. Dr. Mebaza is professor and chair of Department of Anesthesiology and Critical Care in Paris, France, and director of MASCOT, a research group on biotherapies in critical conditions. Dr. Mebaza has been on the front line in caring for COVID-19 patients and has conducted at the same time research to improve the prognosis of these critically ill patients, always striving for excellence, rigor, and high scientific standards. Dr. Mebaza, would you please tell us how you think COVID-19 pandemic has affected research? The virtual podium is yours.
Thank you very much. Again, I'm honored and happy to be part of this discussion. And I would say it reflects a little bit what I'm going to say in the next minutes, which is really, I was in the middle of the fire. I mean, I'm leading 3 ICUs, and one of them was 30 beds. I was here really day and night. And what I missed a lot while being in the front of the fire is to have communications with the rest of the world. And despite all the articles and the papers that were coming slowly, what definitely helped me a lot is to communicate with friends, true friends from Italy. And the lack of Paris, I used to say this many times, the lack for Paris was the crisis started in Italy and in the east part of France, where you may know it was a big catastrophe. And because of that, and I had the people of Nancy, where Alice did her residency, and of Strasbourg, every morning, before the virus came to Paris, to just have the feeling on what should I do when the first patients would come. And again, I was really surprised that there was no official communications among countries and no official communications among continents at any time. And when the wave arrived in the United States, I was so sad that no societies, no government decided to have a special line of communication between Europe, who learned already so much before New York. And when we saw the data coming from New York, when we saw the way of handling patients, I was so sad that all what we learned in the month before between Italy and France and Germany, I'm sure for the next wave and the next crisis, definitely we should we should improve this. And this is true for not only the way of managing patients, but indeed this is what we saw for research. And many things happened, but definitely it was in silo. I am also leading the research for the north of Paris. Paris and the region is around 10 million inhabitants, and I was leading the research. And I participated exactly like Shiro and Alejandro on organizing with the government quick grant, quick turnaround for ethics committee. I mean, it was just a dream come true. What usually takes between 6 months and a year could be done almost within over a weekend. And we had ethics committee, as we heard, for reviewers, ethics committee meeting during the weekend, and then everything was really running incredibly well. But we had again, and maybe this is a disease in Europe and a disease in France, the project, and I heard Alexandro saying at least 2 or 3 times a multidisciplinary approach for project. Here in France and in Europe, we saw a project going one country, basically by country. The money from the European community came rather late when the wave was already out. And inside every country, when some money for France, we had 260 million euros for the first quick grant that was released. I saw the proposals, and I saw the grants that were accepted. There were almost all the grants were done by specialty. You had like the internal medicine, you had the emergency physician, you had the intensivist, and et cetera, et cetera, et cetera. And several times I tried to see how I could try having people working together, but it was really in the middle of the crisis, and it was difficult. People already were taking hours to write the grants, and it was difficult to say, come on, could we sit and have things done smartly instead of having. Then again, I'm very happy to have this webinar, because it really represents what we should have done at different layers, at different time points, at different between maybe the physicians who are taking care of the patients. We did indeed a lot of research here, but the research that we did, and again, I'm just keeping the head of chair of the intensive care, was to answer to the questions. And we had something positive in this disease. And I used to say this to all my residents and fellows and the people who are working really day and night, is you are lucky, every patient has the same disease. And this is really unique, because even we had some bombing and some other things, you have some people on the head, some people on the belly, etc. Here, everybody has exactly the same disease. But interestingly, it's not the same stage, it's not with the same comorbidities, it's not with the same thing, but it's the same disease. And what is really incredible with this crisis is that, and I'm sure for a mathematician it's something very exciting, is that every patient teaches you something for the next patient that teaches you something for the following patient. And usually, in fact, for all our disease, you learn something in medical school. You may learn a little bit looking on New England, but you immediately put a procedure in place, because this is what we are doing in the last 10 years, is procedure, and you just follow the procedure. And here, while for years you are yelling on the people who just follow the procedure, here suddenly you have nothing to show. And indeed, this comes back to what I said earlier. In the 2 weeks that I had between the crisis in Italy, Strasbourg, and Paris, we had to run, all the intensivists were meeting every morning to just have one procedure, the same for all Paris region, the same procedure in place when the wave will start. But rapidly, we discovered that we know nothing because the communication was, as I said earlier, poor, but also because we're just learning. And one of the main example is pulmonary embolism, this big clot that goes to the pulmonary artery. My two first patients were two people of the age of 30 or 35 years old. And the two first died by a pulmonary embolism in the front of us in the ICU. And that 5 minutes later, I was in the front of my computer. I did PubMed, I did Google, I did COVID-19 pulmonary embolism, and the answer was no papers, no results, nothing, no abstract. I couldn't believe it. And I thought, come on, this disease was in China, this disease was in Italy, this disease was in Strasbourg, and there was really nothing. And you see, this is, in that environment, you need to quickly think research and do all what you can. And then we did, yeah, we were focused in the first weeks on pulmonary embolism. We even did a CT scan on all patients who died from sudden death in Paris to discover that there was a huge increase in sudden death related to pulmonary embolism. Well, then this is not necessarily our area of research, but we had to go there because, again, every patient, every group of patients is helping the next patients. And concerning my own lab, because this is my other head on biomarker and biotherapy, and maybe later we will talk about how we did research for COVID. We had two phases. The first phase was that the researcher, even the clinical researcher, the CRAs and the research nurse, etc., were scared to come to the hospital. Then the first weeks, my clinical research team, I had to really maybe lie to them, I don't know, but I had to tell them, don't worry, you will not be directly in the first circle. We will give you data, you will have just to come and have the family signing, but the family was not there. And quickly it became complex because indeed my main way of doing research is to do biobanking, but I can tell you, when we were in a moment where nobody knew the virus, whether it jumps from the blood tube or not, it was difficult to tell them, don't worry. And the first tubes, I had to do them by my own. I mean, I have to, in the front of all the research nurses, I said, you see, I'm doing it. And after 2 or 3 days, I say, okay, I cannot let the boss doing it, and they had to do it. But you see, all this to show you that the beginning, people, we were scared. The nurses had to go on the front line because this is their job, and we had almost no nurses or physicians who said, no, I'm not going to treat patients. But all the people who are in the research activities, it was really very difficult for them. For my basic research lab, the university sent an email saying everybody stay at home. Then they stayed at home. But I try to bring them back as quickly as I could. And indeed, there were rules. We had to put masks. We had to put many things. But we lost, I think like everybody, we lost maybe 3 months of research. Luckily enough, the government decided to not cut our annual budget, but they cut what they named the exceptional budget. But already by keeping our budget, we can finish the year, but I don't know what will happen the next year. I stop here, but I'm sure we'll have other moment to discuss about the details.
Thank you, Dr. Mabaza, for highlighting what's happening in France and Europe. Now we move on to our last panelist for today, Dr. Jody Edwards. Dr. Edwards is the director of the Brain and Heart Nexus Research Program at the University of Ottawa Heart Institute and an assistant professor in the School of Epidemiology and Public Health at the University of Ottawa. Dr. Edwards is a cardiovascular epidemiologist whose research program involves risk assessment and predictive modeling for the heart-brain interface, with a specific focus on the identification of novel cardiac markers of stroke and dementia risk, and women's heart and brain health. Dr. Edwards, looking at COVID-19 pandemic through your scope, how do you think pandemics affect research?
Well, thank you very much. I'd like to thank the organizers for the invitation to be involved today, and also really truly feel honored to be as an early career researcher among these esteemed panelists. So I am going to talk a little bit about, from that early career perspective, some of the impacts, I think, of this pandemic on our research. I conducted a little informal Twitter poll to try and reach out to other people in my situation and get the full scope of the impact. And I really think that, you know, it's across the board, although no researcher domain has been unaffected and no researcher at any stage, there are definitely some unique you know, impacts that do affect someone in an early career stage, such as myself. The majority of people, respondents, really expressed that the funding uncertainty and instability has had a major impact during the pandemic. So for many, although there's been kind of a large influx of new competitions related to COVID, some of the, as has been mentioned, the kind of mainstay competitions, you know, for people outside that domain of research, there's been delays, or, you know, there's been some competitions that have been fully canceled. And I think this, for the early career researcher, really makes it extremely challenging, because we're at this point where we are just getting our labs going, have some first staff members and students coming in and getting projects launched, and potentially just trying to get our first grants flowing, and everything kind of grinds to a halt. And that's been, you know, now there's the stress to kind of fulfill those contracts for staff and HQP, and, you know, not sure how it's going to go when we reopen. I think that for those of us who don't have a large financial reserve, or there's concern in future funding competitions about not having maybe the established record to fall back on. And that was really reflected as well in the fact that 40% of respondents showed that no pilot data collection was their primary concern. So I think people are quite concerned about moving forward, how the fact, you know, the lack of productivity around getting data collected for future funding competitions it really might be limiting as well. I think that one of the things that might be very reassuring to early career investigators is potentially if funding agencies, you know, could make allowance over the next, in the short term, for some of the future competitions regarding the inclusion of pilot data, though it's very, you know, important and critical to the review process. Having sat on some of those review panels, you know, I think that it's one of the impacts that the pandemic's gonna have moving forward. Another major issue was just the impact on publishing productivity. And I know that I have felt this, and I think that a lot of research, this has been alluded to by some of the other panelists, but a lot of people, you know, like in my situation as well, at the early career stage, may be more likely to have a young family at home, and maybe having to deal with childcare responsibilities in addition to trying to continue to move content, and it's a big challenge. So I think that not only has this created kind of a double hit for a lot of young career investigators in terms of, you know, trying to be productive and have childcare responsibilities, but it's also really created this kind of variable bimodal distribution of those that are being extremely productive because, you know, they're able to get to those manuscripts that have been sitting there, or interrogate, you know, data sets that have been previously unexamined, and they don't necessarily have those other commitments. But then those that do are you know, really taking a hit. So I think that that's something that, just to know that the playing field is not going to be level moving forward because of some of these impacts. I think another worry for early career investigators is whether the funding agencies are going to kind of adjust the clock on what's considered to be early career, that time limit, and similarly within institutions, whether or not the tenure clock is going to be moved, and kind of considerations made for this delay. And you know, not knowing how long the delay is going to be, I think presents a real challenge and uncertainty for people. So I think these are some of the, maybe not unique to early career investigators, but maybe uniquely felt by early career investigators, some of the impacts, of the pandemic. And I do think from my own perspective, of course, my lab has been closed. I feel lucky in a way that as an epidemiologist, much of my work is with existing data sets. And so much of that can continue. But as indicated, it's in balance with some of the childcare responsibilities. And then from my own perspective as well, as some of you know, I had COVID and took about 8 weeks to recover from that. So have the unique perspective as well of having undergone the experience, had the disease, and needed to recover before I could really return in any measurable way to my work. So I think that it's a unique time, and those of us just starting out didn't really anticipate this. In addition to the challenges of just getting our labs going and facing new faculty positions, but I'm hopeful as a community. I think that people have really pulled together, and we're really going to try and support each other moving forward. And I think that we felt that from the funding agencies and from our mentors and more senior colleagues. I think it's a real time in Canada and in other places I see as well for the research community to pull together. So I'll stop there for now and address other questions down the road. Thank you.
Thank you, Dr. Edwards, and we're very happy to see that you're feeling better now. And thank you to all our panelists. This concludes the first section of this panel forum. Now in the second section, we will ask our panelists to answer questions sent to us from the audience via the Q&A box. I'll give the podium now to my partner, Alice, for the first question.
Thank you, Lara. And thank you to our expert panel for this engaging discussion so far. So proceeding with the first question, this question is directing to Dr. Adem. So Dr. Adem, COVID-19 responses have shown the value of multidisciplinary research to mount a much more efficient and accelerated way of tackling new challenges, such as infectious disease. Can you comment on the potential of national agencies promoting and amplifying this trend of interdisciplinarity for a better scientific outcome for the public? The virtual podium is yours.
Okay. Hello. Yes. Yeah. Thank you. Thank you for the question. Indeed, I think for when you want to do research that is meant to solve a problem, you can't fall into the disciplinary silos. You really have to take an interdisciplinary approach. And in fact, some would say a transdisciplinary approach. So what has happened over the past 2 or 3 years is that the government of Canada has launched a new stream of funding called the New Frontiers in Research Fund that is funding a truly interdisciplinary, transdisciplinary activities. These are meant to straddle, to cover topics from all 3 councils or pairs of the councils. And when I talk about councils, I say CIHR, SSHRC, and NSERC, because we know that many of the problems that Canada is facing and society faces really involve expertise from a very wide group of disciplines. So there are a variety of streams there. I want to mention the exploration stream and the transformation stream. I think the transformation competition is being launched, and we should be getting some very, very interesting applications about building this transdisciplinary approach to research. So those opportunities now exist, and this was, of course, based on the findings of the Naylor report, saying that there was a need for more interdisciplinary, transdisciplinary research. At the same time, I think the agencies have also taken upon themselves, individually or in pairs or in some collection, to work on interdisciplinary problems and to use whatever expertise is available. In particular, at NSERC, we have reached out to a number of government departments to create calls for proposals where academic scientists can work on problems that the government wants to see solutions to. And I can mention things like forest fires, There's a recent call for proposals there, plastics, things of that time, where in that case, interdisciplinary might mean a collection of natural sciences and science and engineers that also should be working together that previously were in their own silos. So there are a variety of mechanisms. So I think nothing is better than experience, a strong experience to get folks to think differently and to break out of their silos. Now, when I say this, of course, we also have to be very conscious and value the depth of expertise that the disciplinary scientists have. You know, they talk about the 10,000 hours to learn a subject. Well, maybe in some of our areas, to think of quantum physics, think of very, very, cutting edge areas of science, natural science and engineering that I'm familiar with, we have to be respectful of the time and the depth of the ideas. So how you integrate the depth with the impact is, of course, one of the challenges of research funding. But I think we're well on our way to doing that. And this experience of the COVID-19 and working very closely, the council is working very closely, as well as the role of the Canada Research Coordinating Committee. We haven't talked about them, but they played a big role in coordinating the response that Canada has taken. And the Chief Science Advisor is also involved in that. And of course, our friends in the government, like the National Research Council, that they do research in government labs. So putting all that together, I think, is indeed very important. And I think this experience has really taken us one leap forward in this idea of all working together and in different combinations to address concrete problems.
Thank you, Dr. Adam. My next question coming from the audience is to Dr. Koscheck. COVID-19 has brought a lot of attention to infectious disease research, specifically viral contracted infections. While this is necessary at the present moment, how can we ensure that research in other areas is not going to get delayed or suffer as we enter a new phase of research landscape post the 2020 pandemic?
Thank you, Laura. So yeah, that's a really important question, and I can tell you that at CIHR, so the 13 institute directors, along with the president and the senior executive team, we have what we call our Friday afternoon meetings, where we spend an hour and a half talking about topical issues, administrative issues, and frequently, very frequently, this issue has come up, in terms of it being an amazing opportunity for research in science, viral immunology researchers, other researchers who are, in respirology or cardiac, pulmonary. But at the same time, there's a lot of areas of research that are not directly connected. Although, we are now launching applications in mental health and everything. But as an example, my research in HIV, my lab has been shut down. So there is definitely a lot of anxiety in terms of, how do we get back on track? I've read in some of the places where people are, trying to reassure that all of us are affected in the same way. So people who are running research agencies, the people in government, are not unaware of the fact how this has affected everybody, including the researchers. So to Jody's point, where she was pointing out that early career investigators are uniquely affected, I can assure you that all of us know exactly what she's talking about, and exactly the 3 points that she's brought up. We spend hours talking about those points. So we're all aware of this. CIHR, as you know, had to cancel the spring competition, which had a lot of fallout in terms of the anxiety levels and everything. And as soon as we could, we recognized the impact it was having, and again, came together to sort of say, okay, things are stabilizing in Canada. It's not as bad as we thought it was going to be. Let's start to get things back on track. And as you know, the spring competitions are back, which is the main bread and butter for a lot of people who work in areas of their own choice, not particularly related to COVID-19. So that's back on track, and CIHR has reassured that the future competitions will be back on track. Many of us who are running institutes have our own strategic investment opportunities that have been sort of stalled and waiting. And that's the next thing that we're working on. How do we get back on that track again as well? So I think all of us have to take a deep breath. None of us planned for it, but here we are, and hopefully there's not a clear path out of it, but at least we know how to deal with it as we have for the last 6 months. And this is the new normal, and we're all trying to normalize. And hopefully, we are going to get things back on track. But I can tell you that there's clear recognition that, we have to focus on things beyond just COVID. In my area of research, vaccination hesitancy. So that's one of my big worries, that even if we get a vaccine for COVID, we're going to have a lot of people, given the past track record in the past 5 or 10 years, where there's a lot of vaccine hesitancy. So that's occupying a lot of our time. AMR, antimicrobial resistance, that was something that was a huge part of our portfolio, because it's a slow-moving disaster with same outcomes as COVID. So many of those, those haven't dropped off the radar. It's just that all of us, just like at home, we are focusing on dealing with our kids and dealing with things that are happening right now. So let's not say that things are normal and how can we just act like normal. Things are not normal, but all of us will strive to make sure that things get back on track as we move towards finding an end to this problem. So I just want to give some reassurance to everybody who's listening today that we're all aware that there will be life after COVID, and many of us who can are in a mode to start to look beyond that, to sort of say, how can we get back to normal as people are starting to get their labs back open, etc. So I hope that addresses that question a little bit.
Thank you, Dr. Koscheck. So the next question from the audience is for Dr. Mebaza. So, Dr. Mebaza, what lessons are we learning this year regarding clinical research and data reporting, coming from the increased focus and requirement for accelerated action regarding the COVID-19 pandemic? The virtual podium is yours.
You hear me?
Yes.
Thank you for this question. I think first I like very much the initial questions, because I understand so well this worried about having funds for people who are not working in the COVID area, which is also my research lab. My research lab is on heart failure, and I used to say that heart failure kills more than COVID-19 every year, even if the COVID keep killing patients. Then there are still a lot of issues that needs to be resolved all around the world. Concerning clinical research, first, as I said earlier, many staff people of the clinical research left the hospital for many weeks because they were scared to have the disease. Then many projects stopped. Many trials also stopped in area outside of COVID because we didn't have the patients, because we were scared to have the patient may have had COVID. Even the patient comes for emergency for a peritonitis or something, it was difficult to quickly see whether they have COVID or not. And for example, transplant, there are a lot of trials in transplant that were also stopped. Transplant was reduced. Then I would say all clinical research stopped. Myself, I am PI of 3 studies in heart failure all around the world. They also stopped because we are not going to include patients who may have COVID while you are looking for a drug that is actionable on heart failure. Then it's true that in addition to all what I heard, which is very important, and I think again, Jody, thank you very much for insisting that the grant, the money, all the next generation of researcher needs to be reassured that they will have the funding for the grants that we got for clinical research. I can tell you that we are also scared because we don't see how with the money that we got, we are going to finish the studies because we need to pay the CRAs, we need to pay all those people, and that there is no patients. Basically, we have zero recruitment since 3 months, and it's going to stay so for probably additional months, at least in Europe. And we don't know how to go out from this. And at least I hope I answered your question. But right now we don't know how to go out from the clinical research issue that we are facing right now.
Thank you, Dr. Mabaza. The next question is for Dr. Edwards. So the early data records show that the prevalence and severity of COVID-19 seem to have a sex difference component to it. What is your early take comment on this? And more generally, how do you think sex difference as a variable needs to be addressed in future research as compared to the recent past and present state?
Yeah, thank you for the question. So I think actually in the available sex disaggregated data that I've seen, and if you look in the global health data tracker on sex disaggregated country-specific data, it has shown that there really isn't a clear pattern of incidence of COVID-19 by sex, where some countries show a slightly higher proportion among women and some among men, but really where the sex differences become apparent is in disease severity and mortality, which is much higher among men, and that's consistent across the majority of countries where the data is available. So I think that there's a lot of efforts and focus being drawn towards this, specifically investigating outcomes and sex differences among outcomes, and some of the factors that have been speculated to contribute to this difference in mortality has been potentially some of the interaction with sex hormones and the RAS system, which is associated with hypertensive risk factors as well, and particularly in the expression of ACE2, which is the receptor for the SARS-CoV-2, and then that's what leads to COVID-19. So I think there's lots to be done in that domain. And I also think that a potential factor that might be involved is a higher prevalence of some of the underlying health conditions, such as type 1 diabetes and some heart diseases among men may translate into worse outcomes. So I think it's still early days, but we're definitely seeing a clear pattern of sex difference with respect to mortality, but not necessarily for incidence. Oh, and in terms of moving forward, sorry to answer the last component of your question. I mean, it's clearly critical that, for all research to have a sex-specific lens and to look, at differences both in incidence and risk factors, but also in outcomes in a sex-specific manner. And I think that the pandemic has really highlighted and reinforced, the need for us to be looking at the physiology in a different way among different sexes. Thank you.
Thank you, Dr. Edwards. And as we bring our research webinar to a close, on behalf of the COVID Spectrum team, I would like to thank our audience for their participation, and we hope that this webinar session has given you a much clearer understanding of the effect of COVID-19 pandemic on research. I would like also to thank our panelists for accepting our invitation. Your expert opinion is much needed during these times. One last question for our panelists, and I will invite you one by one to give your answer. What's the one thing you want the audience to know as a way to coming out of this discussion on research? We can start with Dr. Adem.
Thank you. Well, I think the main thing the message I would like to give to researchers is, we want to support you in every way possible, we the funding agencies, so you can continue doing your world-class research, whether or not it's directly relevant to COVID-19. What you're doing is valuable. If you're funded by agencies, we want you to understand that this is important for us. We have a number of measures that have been announced to support young people, in particular NSERC. We are providing a funded one-year extension for all discovery grants so that folks can settle down. We understand that this disruption will be more than a few months because a pandemic is a long-term thing, and we don't know what the ending of this will look like. So work hard on your stuff, and we are working very hard with the government and with our partners in government to find ways to support you, in particular young researchers. It's very important that you keep on working on your things. We understand the difficulties, and we're seeking to address them. So the way we're going to get out of this crisis is through science and research and the young people. So it's important not to be discouraged and to keep on doing everything you can, and to let us know also how we can help make things mitigate the impact of the crisis. Thank you.
Thank you. Dr. Koscheck?
I guess my one thought on this is that I think our world has changed. You know, it's one of those benchmark moments which all of us will, whether we are scientists, researchers, parents, individuals, we will always be talking about, you know, before COVID and after COVID. So I think our world has changed in terms of research. You know, the way we do research has changed. What would have probably taken a generation has changed in less than 6 months. You know, the extent of collaboration, globalization, exchange of information, dealing with misinformation, the inequities that have come out from this, which we haven't anticipated or even thought about. You know, clearly there's a lot of information that's going to come out that we will look back and figure out ways. My hope is that we will take the good that has come out of this in terms of how quickly we can exchange information. You know, I was attending a WHO meeting on COVID last week, and there were 1,200 people attending that conference from all 5 different continents across, you know, how many time zones. This would have never happened before. So some things that have changed forever will be for better, and some things that we really need to look at, you know, some of the inequities that have clearly come out, not only in terms of how the COVID is affecting people, the social inequities, but even within researchers, how it's brought out the extra burden on people, you know, who are dealing, for example, with increased childcare burden. You know, that has become very obvious that we need to deal with those kind of situations in a more thoughtful manner. And again, like Alejandro, I will say that we're on it. We will think about it. We will come back with some thoughtful ways to move forward, hopefully integrating some of the good things that have come out of this and dealing with some of the challenges that have come out of it. And hopefully we'll come out as our community, research community, has more resilient and ready to deal with what comes our way.
Thank you, Dr. Koscheck. And now I will ask Dr. Mebaza to answer the question, please. So, Dr. Mebaza, what's the one thing you want the audience to know as a way to coming out of this discussion on research?
Yeah, I would also say that things cannot be like before. And really, I would like to insist that research forces should come together from all around the world. I think it's not something that is impossible to achieve. I think you heard, I was telling you that we gave a lot of money for some grants. Canada, the US also gave a lot of money, and it's really difficult to believe that maybe the same project was funded in maybe 3 different countries by small team who tried to answer to those questions, and we didn't put even more money, but the 3 teams together. And really, this is for me the next step. The next step is to find political ways to have research done as a global network. And today, the only force that can do international studies is the industry, the pharmaceutical industry. And I think this is not the right way. I guess we should find public funding to also compete and also to international studies in emergency. And we can do it. We just need some political push for that. But I believe for this kind of pandemic, the only way is to put research forces and smartness all around the world together.
Thank you, Dr. Mebaza. And finally, I would ask a question to Dr. Edwards.
Thank you. Well, I would say that for me, the one thing, and this probably reflects my bias as an epidemiologist, but I think that the one thing that this pandemic has really highlighted for me is and I want everyone to think about is really the critical importance of significant and sustained investment in public health, both in terms of research and in implementation and how that impacts our health policies and health systems. I think that we've seen a really clear demarcation during this pandemic between countries, both in terms of getting the virus under control and in terms of mortality for those countries that sort of aligned with public health evidence and experts, and those that did not. And I think that we cannot ignore the impact of research for prevention and for public health measures.
Thank you, Dr. Edwards. This concludes our webinar for today. Stay tuned for future content and announcements coming from us to share with you. And for more information, visit our website at www.covidspectrum.com. Follow us on Twitter at COVID Spectrum and subscribe to our YouTube COVID Spectrum channel. If you have any comments and feedback for us, we would love to hear back from you. For that, you can visit our website and go to the Contact Us tab to send your message. Until next time, stay safe wherever you are.
Thank you.
Thank you. Bye-bye.
Thank you.